Joining me live now is Labor MP for Robertson, Gordon Reid, and Independent MP for Fowler, Dai Lee. Good to see both of you. Welcome to 2026. We are going to see, it looks like, a rate rise on Tuesday. So for all the fire and fury of politics in Canberra at the moment, it reminds us that cost of living is number 1, 2 and 3 for most people. Dai, give us a lay of the land in Western Sydney.
Look, good morning. Hi, Gordon. And it's great to be back with you to Laura and to our Sky News audience for 2026. And I have been harping on your show for quite a while now, Laura, around the cost of living, and it's going to be worse. Obviously, with the news that potential interest rates hikes for families in Fowler, that's not just a number. It talks about grocery bills, energy bills, and for small businesses here who haven't got much of a break through the home battery scheme, costs in energy prices will flow on to obviously consumers and the mums and dads. So I really think that the government needs to look at some sort of structural, fix. It's not just a sugar hit handing out rebates to everybody and not a targeted rebate. So it's a huge issue, and interest rate rises will mean mortgage. That will impact a lot of families here in Western Sydney. So
yeah. Okay, well, Gordon, let's get your take as well, because governments like to take credit for interest rate cuts on their books, but when it comes to rises, they tend to say, oh, no, this isn't our fault. Is it?
Well, look, there have been interest rate cuts under the Albanese Labor government and the policies that we have instituted. But, here in Robertson, here on the Central Coast, and as Di has said, cost of living remains one of the number one issues for Australians here and right across the country. And we know that inflation is still higher than we would like, and that's why we're implementing targeted policies, targeted cost of living relief to help with Australians accessing the care that they need, accessing the services they need, but also to making sure that we put downward pressure on that cost of living. We opened up an urgent care, a bulk billing urgent care centre here in Erina in the last couple of days, a bulk billed urgent care clinic. If you're too sick for the GP, not sick enough for the ED, that has multiple different arms, takes pressure off the hospitals, pressure off the GP, but it's also a bulk billed service, which means that people aren't paying for medical care that they need when they need it. And that's really important. And that's really a focus of, not just the Albanese Labor government, but us in a more general sense, that we're putting downward pressure on inflation, putting downward pressure on cost of living, and making sure that people can get the services that they need when they need it.
You're far from perfect though, Gordon. So what kind of responsibility does this government take for this cost of living crisis that is ongoing, and it's going to get a little bit worse on Tuesday?
Well, look, we know that we inherited before 2022 a significant budget deficit. We inherited significant rising inflation, and we've been able to put downward pressure on that over a period of...
Yeah, sure. But the election was almost a year ago now. That's running out a little bit, isn't it?
People can get the care, can get the services that they need, whether it be education, whether it be health, whether it be energy rebates, whether it be tax cuts for all Australians. The Albanese government is focused on making sure that Australians get the cost of living support that they need when they need it. And that is a substantial achievement of this government, and that was shown in the May 2025 election results with 94 lower house seats.
Okay, well, I would just point out just quickly, and Dai, you can respond to this. I just spoke to Daniel Mookie. He's the New South Wales Treasurer. He says he's still having a fight with the Albanese government over getting enough money for health, enough money for this Thriving Kids program, which is a breakaway from the NDIS. But Dai, what did you want to say?
Look, there are quite a few things, and it's great to have some urgent care clinics open, but that doesn't actually address the major costs of the inflation and the rising cost of living. Is one of the main drivers of that is energy, and the energy policy. We've heard that New South Wales has continued to open the Eraring coal mining because basically the grid is still, there's the huge demand of our energy. I support renewable. I've got that, but I think for majority of Australians, especially out here in Western Sydney, who can't buy battery, can't afford to have a battery, can't afford to have solar panels, it's still a big issue. And for small businesses, it's very critical. Our small businesses are the engine of our community and if no doubt for our country. So urgent care clinics is one thing, but the energy policy, which is a really one of the key drivers of inflation, something has to be done. And I think the government spending in terms of the last term of, the constant sugar hits in terms of energy rebates, and obviously by giving energy rebates, they acknowledge that it's a problem, but they need to move into a structural long-term solution.
Okay. Well, energy is a good point, isn't it, Gordon? I mean, we require all this new energy for the AI data centres. We've had Larry Fink saying you can't run them on renewables alone. Origin Energy over the Christmas break saying, well, we're going to extend Eraring. I mean, we need to just really level with the Australian people, don't we, about the cost of renewables?
Well, no, look, energy is a particularly important topic here on the Central Coast and here in Robertson. And we know that the Albanese Labor government is committed to a transition in the energy space. And I often talk about energy sovereignty and energy security being multiple sources of energy for the Australian people. And we know that the element of renewable energy in the grid is increasing and providing more stability. But I just want to go back to the point that was just made with regards to quick sugar hits from our government to help with cost of living and supporting the Australian people. Urgent care, it's not just the occasional urgent care clinic. It's not just a quick discussion about the National Hospital Agreement. It's not just a tiny sugar hit. These are major reforms that are happening right across the economy in different sectors to support the Australian people. When it comes to urgent care, there is literally a new model of care, a new subspecialty of medicine being created in Australia right now that is providing care and support for Australians who are too sick for the GP and not sick enough for the emergency department. I wouldn't call that any small feat. That is a major advance in the Australian healthcare system and the Australian health model of care for all of our communities, the Central Coast in particular, which now has 3 Medicare urgent care clinics. And just on the discussion between the New South Wales Treasurer, Daniel Mookhey, and also to the federal government, these are significant discussions to be had with regards to our National Hospital Agreement to do with healthcare and disability, but also to making sure that we can really address what issues are current and present in our hospitals, which is logjam, which is bed block, making sure that we are addressing the issues of inpatient healthcare, of disability, but also to transitional care and aged care beds and support, which is what this agreement is about and the collaborative discussion that is happening between the New South Wales government and the Commonwealth.
Okay, can I interject there? So urgent care clinics, you get a private clinic and then do some sort of agreement, and then they provide urgent care clinic by providing Medicare, charging on Medicare card. Now, we have doctors shortages here in Southwest Sydney. We've got doctors shortages in Southwest Sydney. Our doctors are retiring. They're too old. There's shortages of staff, and there's not enough funding for our hospitals to care. So to care for a community like Fowler. So it's great. News that we've got more urgent care clinics, but the reality is that we don't actually, the doctors' problem, the shortages of doctors' problems, and I'm sure you understand this, Gordon, and the shortages of nursing staff and the shortages of the money in our actual hospital system is not there. Okay. So I think I
Gordon,
agree.
I'll just quickly get you to address that. You are a doctor. You've lived some of this, so tell us what's going on. And does Di have a point about the funding and getting the nurses in there?
Yeah, look, live some of it and currently live it as well as a practicing emergency doctor. On the topic of GP workforce, this year, and we saw this from the State of the Nation report through the RACGP, we're now looking at near fully subscribed GP registrar training positions across the country, meaning that workforce pipeline of Australian-trained GPs is now working through the Australian healthcare system across the board, which is an absolutely fantastic result. And not only that, that is the result of deliberate policies under the Health Minister, Mark Butler, and the Albanese Labor government to support workforce. Okay. And also, too, yes, our hospitals need more funding. Yes, our healthcare system needs more funding. That is what the National Health Agreement is. And that is why, in New South Wales in particular, Daniel Mookhey and the Commonwealth are currently in negotiations as to what that looks like to address bed block and log jams.
Yeah. Sorry to cut you off, Gordon. I didn't mean to interrupt you there, but yeah, you make a good point. He drives a hard bargain in New South Wales, Daniel Mookie. And, I mean, it must divide your loyalty a bit being a New South Wales MP and also a member of the federal parliament. But I love your passion, both of you. Gordon, Dai, we'll have to leave it there.